This is a demonstration of how to use the new appendectomy and cholecystectomy Synoptic Operative reports. The first step is to go ahead and log into Sunrise Clinical Manager. Within Sunrise Clinical Manager, ensure you have the appropriate list and the appropriate patient selected, and then come up to the Enter Document tab here. Click into the Search For box, and if you type OP, it will bring up the two relevant operative reports for appendectomy and cholecystectomy. You can highlight the report and click Open, or you can double-click the report to open it. I'm going to run through what a typical appendectomy report might look like. It asks for the date. By choosing this small icon of the clock here, it automatically populates today's date when you're filling out the report. Then asks you for a post-operative diagnosis, and if it's not appendicitis, you can choose other, and you can type in some alternate diagnosis. Then asks you for the procedure you performed, and if for some reason you had to convert, you can choose that, and you can choose why you had to convert. Similarly, if you needed to do a more extensive procedure or another procedure, you can explain that. If you had to do any additional procedures, you have somewhere to add that. Although note there is an area for lysis of adhesions later in the report. Any field indicated by this blue star must be filled for the report to be considered complete. You have to manually enter the surgeon and the anesthesiologist. If you wish, you can add clinical history. You can add in whether there is any imaging completed to make the diagnosis, say an ultrasound in this case, as well as clinical factors. What preoperative antibiotics the patient got. If for some reason the antibiotics were not given, you can specify a reason for that. But I'll choose what may be some typical preoperative antibiotics. What preoperative thromboprophylaxis was used, if the patient had stockings. You can indicate that the surgical checklist timeout was completed. If it was not, you must specify a reason. There's really few instances where this should occur. Whether there was any hair clipped on the abdomen, and whether the patient had a urinary catheter placed. For the procedure itself, you'll indicate your access. So if you had a Hassan trocar placed in a periumbilical position, and how you close that Hassan trocar, say with absorbable sutures. If for some reason you used a varus needle instead, you could choose the left upper quadrant for the location or another location. And then there's also options for open procedures. It also asks you how you closed the Hassan trocar site fascia. Then it asks you to indicate what trocars you used, say one 5mm trocar and one 12mm trocar in the left lower quadrant, whether you closed the fascia at the 12mm trocar site, whether there was any adhesiolysis that had to occur in addition to the appendectomy, what the appearance of the appendix was, whether there was any other additional pathology noted, and you'll note none is pre-selected. If you were to choose other, you receive a text box where you can enter other pathology. You'll have to indicate how you controlled the appendix, say with endoloops. If you have any additional comments you wish to insert. Indicate how you controlled the mesoappendix. Indicate whether you used a bag or not to remove the appendix and where you removed the appendix through. Indicate whether there were any drains. If there are, then it can ask you for the drain location. You can fill it in. This line is an error, ignore it. Whether there was any local anesthetic injected, you can indicate. You can indicate how the skin was closed, what the estimated blood loss was, if there was any difficulty or error with the counts, what the disposition of the patient is, if there are any complications during the procedure, and whether the patient is going to go on to any postoperative antibiotics. You have an option to copy any physicians you think need it to be copied by choosing this button and then finding the physician in the system. And then finally, you can choose if the report is complete. Critical for trainees, you must choose authored by other and select the operating surgeon. So I'm again going to choose other, and in here I'm going to type the staff on call, for example. You must choose this staff and make sure they are the author over here. This is critical because this is how these staff will find the report to sign it and finalize it so that it's populated to NetCare. If a staff surgeon is completing this, they will automatically be the author, and therefore they will not have to touch this report again once they sign it. Finally, in the bottom right, you click Save, and the report will be populated to NetCare and SCM and faxed to the family physician's office, who has been indicated right here.